So the इसका ये है osteoporosis diagnosed 2018. So osteoporosis was diagnosed 2018. This is just giving you, and I also said after this next class will be about linking words, where I will be giving you linking words wholly solely. Okay. Next is history. Please write it down because then बाकी का you will be doing all by yourself. This is only first and the last because I can't do everything with you. Okay. Next is history of falls, 2 incidents in last 6 months. So now you will write a history of falls has been reported, comma, with 2 incidents occurring in the last 6 months.
Has been recorded.
A history of falls has been reported, comma, with 2 incidents occurring in the last 6 months. Alternative, we can write 2 incidents of falls. See, अब हम क्या कर रहे हैं, हम end को लेके start में ला रहे हैं. 2 incidents of falls have been reported in the last 6 months. ये doubt classing लोग की हुई थी. Has been reported. Have been reported in the last 6 months. Okay, next, have you written? Next is former smoker. So you can say a history of smoking was reported with 40 pack years.
History of smoking
was reported with 40 pack years, comma, until quitting in 2012.
A history of smoking was reported
with 40 pack years. जो लिखा है आपका 40 pack years, जैसे लिखा वैसे लिखना है. The way it is written. Okay. Then you have to write a comma until quitting in 2012. So punctuation should be taken care of. Now alternative, you can also write this like smoking cessation. CESSATION. Session occurred. So here we are using good vocabulary. Occurred in 2012 after 40 pack years of smoking. So session is stop. After 40 pack years of smoking. Now next is
current admission. She was admitted in a hospital with the complaints of.
So passive voice में लिखेंगे इसका current admission. See, admission to the current hospital stay was made on January 3, 2025. You can write it down, the passive voice. What happened? You don't want to write? No.
I want to write, but I get.
Yes, ma'am. We write. She was admitted in hospital.
Admission to the current hospital. See, this is what passive voice is all about.
अच्छा मैम इसको कैसे लिखेंगे पैसिव में?
So passive
हाइपरटेंशन.
This is the passive voice.
हम letter के according कर रहे थे, sorry.
We are doing as per the passive voice. कि just in case when you are writing you have to use passive voice. So how you will be able to write in passive voice? एक बार ऐसे लिख के देखो, you will feel good about yourself, your writing. Yeah, you can also say the patient was admitted on January 3, 2025.
हाइपरटेंशन को पैसिव में ऐसे कैसे लिखेंगे कि वो 2010 से उसको है और अभी भी है और आगे भी रहेगा, क्योंकि हाइपरटेंशन तो खत्म नहीं होता.
हाँ, hypertension never gets over. I have already given hypertension was first diagnosed and it has been लिखा हुआ and has been managed since then.
Hypertension has been managed
Since then. So it is already I have given you. I think you did not write maybe. Okay. Next क्या है? Reason.
Patient was admitted
on January 3. Admission to the current hospital stay was made on January. You can write this also.
She was suffered with shortness.
हाँ, just I'm giving it. Wait, I will just give you one thing which you will like it. Initial diagnosis. Okay, जो ये पूरा है का करंट एडमिशन का I have written it in a paragraph. Okay, जैसे you were saying ना कि you want it in a paragraph. ठीक है? So admission to the current hospital stay was made on January 3, 2025 due to symptoms of shortness of breath, wheezing and productive cough with sputum and initial diagnosis of acute exacerbation of chronic obstruction pulmonary disease जो आपका है bracket में I have just elaborated it was made. So ये पूरा लिख के I have written was made. Alternatively, you can write the patient was admitted on January with with symptoms of shortness of breath, wheezing and productive cough with sputum and was diagnosed with acute वो जो आपका है ना AECOPD तो वो पूरा exaggerate कर दिया acute exacerbation of chronic obstructive pulmonary disease. So ये पूरा I have given you with the passive voice. Okay, is it understood?
Yes, ma'am. Post diagnostic
Now we will do clinical findings.
and post diagnostic.
Next is please read it. Read. जोर से.
Chest X-ray, hyperinflation, no consolidation, blood gas, hypoxemia, PaO2 62 mmHg on room air, and sputum culture positive for pseudomonas.
Okay, next is
And
sputum.
venosa.
So how will you write this? How will you write this?
no consolidation was finding in chest X-ray,
Blood gas.
but pseudomia organisms was positive with blood gas show hypoxemia PaO2 62 mg on room air.
Okay, now clinical findings revealed. You can write it down. Clinical findings, because this is in clinical findings, right? Clinical findings revealed a chest X-ray showing hyperinflation with no
showing hyperinflation with no consolidation.
हाँ, full stop. Blood gas analysis indicated hypoxemia, comma,
Analysis
indicated
indicated
hypoxemia, comma, with a PaO2 of mmHg on room air. Full stop.
Hypoxemia with PaO2.
Of mmHg on room air. A sputum culture was found to be positive for Pseudomonas aeruginosa. Which bimari is this? Which problem is this? Okay? Understood?
A sputum culture will be
Found to be positive.
a sputum culture found to be positive.
Was found to be positive. A sputum culture was found to be positive for the
Pseudomonas.
now alternative also you can write a chest x-ray was performed, comma, revealing hyperinflation with no consolidation.
A chest X-ray
Was performed. This is an alternative which I am giving. You can also write this with other way. A chest x-ray was performed, comma, revealing hyperinflation with no consolidation. Blood gas analysis was conducted, comma, in I'm fast. I know. It's okay.
revealing hyperinflation with no consolidation.
Full stop.
Yes, ma'am.
Blood gas analysis was conducted, comma,
Analysis was conducted.
yes, indicating hypoxemia, comma, with a PaO2 of mmHg on room air. A sputum culture,
Full stop.
a sputum culture was obtained, comma, and Pseudomonas aeruginosa was isolated,
A sputum culture was obtained.
comma, and write the name of the disease.
Pseudo. Yes, ma'am.
Write the name of the disease was isolated.
Isolated.
Yeah. My God. Just remove the password for sometimes. Okay? You want it in paragraph, right? I gave you in paragraph. Next is treatment provided. Please help him write.
Was conducted. Indicated hypoxemia with the
Speak in English. कौन सा वाला नहीं? English में बोलो.
blood test was conducted. Indicated hypoxemia with a PaO2 of mmHg.
62.
62 mmHg room air. A sputum culture. Sputum culture was obtained and
Pseudomonas aeruginosa was isolated.
क्या करके? What happened? What happened?
मुझे ना इसका समझ में आता क्या बोल जाता है कुछ ऐसे हो जाता है
I was telling कि
Speak in
if
English.
I write like in that way, the whole letter in the passive, it would be more than up to 300 words.
but
We have to see the words limit also.
But we have to write under the 200 and above the 190.
Word limit is very important. Just give me 2 minutes. I'll let you know. Actually, it's too much.
Actually, then less information in this letter. There are some letters that have content they have to filter.
Yes, you have to filter, you have to see which is important, which is not important.
This
So that's why, you know, I was giving you one sentence that such that you know which one you have to take. But you are like, no, I wanted paragraph. You know, it would be better if you do in sentences, because this is what happens. You decide you have to take this, you decide you don't have to take this, you decide you have to filter this. So this was my main motto. Okay, let's do that way will be better. At least you know that you have to take this sentence, and in case you have to filter, you don't have to write the whole paragraph. No, because see, when we are writing in a whole paragraph way, what are we doing? We are including everything. Maybe that everything is not required. Okay. Abhi we'll do till here. Nebulize सबका था ना? 1992. So you can say treatment was provided consisting of intravenous antibiotics, IV.
Treatment
Was provided consisting, everything is going in passive, no? So passive में we change. Consisting of intravenous antibiotic, then which is there in the bracket, no? Piperacillin, tazobactam, administered for 7 days.
Consistent of intravenous
Antibiotic, piperacillin and tazobactam, administered for 7 days. Full stop. Oxygen therapy was initiated at 2L mm via nasal cannula.
Oxygen therapy
Was initiated at 2L/min via nasal cannula, and then titrated to maintain an SOPO2 of 90 to 92%. Okay, have you written?
Yes, ma'am.
Now next is, you can also say nebulization. Nebulized bronchodilators were also administered.
Administered
8 minutes.
every 6 hours.
Every 6 hours, just 8 minutes. You know how to write the medications name, so you can use that. Were administered every 6 hours.
She has been prescribed with prednisolone 30 mg once daily for 5 days.
So you can say prednisolone 30 mg was administered once daily for 5 days. Once daily for 5 days.
इसमें has been नहीं लगा सकते. Has been नहीं लगा सकते इसमें.
Was administered. Yeah, you can say has been administered. Okay, next is physiotherapy, breathing exercise का you can say physiotherapy including breathing exercises and mobilization was provided. So was की जगह वैसे मैं एक sentence कर रही हूँ ना, you then do has been and then you can ऐसे करके. This way you know that which sentence you have to pick and which sentence you have to discard. Okay? Because then you cannot include everything in your letters. You have to be wise enough. Which one you have to select, which one is the problem, because there are so many problems. And then have you guys been to hospital, like you guys have work somewhere? And you?
Internship, ma'am. 1 year ago.
1 year ago. Abhi you are not in touch?
No.
Maybe you are doing something at home or something. looking after?
No, ma'am.
Only
But my experience jumped 9 years to
Yes. Where?
Metro Hospital, Dwarka.
Okay, now progress was noted with symptoms showing improvement. Although is a linking word. Although occasional dyspnea persisted, mobilization was being done slowly with the assistance of a walker. Progress was noted, comma, with symptoms showing improvement, comma, although occasional dyspnea persisted. नहीं हुआ. Progress was noted, comma, with symptoms showing improvement.
With symptoms
Showing improvement, comma, although occasional dyspnea persisted,
although occasional
dyspnea promoted,
dyspnea persisted.
persisted, not promoted. Mobilization was being done. ये persisted के बाद full stop. Mobilization was being done slowly with the assistance of a walker. With the assistance of a walker.
Mobilization was being.
सब हम पास में कर रहे हैं ना. Was being done slowly with the assistance of a walker.
Persistent.
Discharge plan. Here is a discharge plan was formulated and home oxygen therapy was arranged.
Formulated and
Home oxygen therapy was arranged.
it was arranged
With Y12 of L min to be administered as required.
extras and required.
arranged and
Arranged with 1 to 2 liter per minute. Administered as required. As required.
अगर बार बार वो repeat हो रहा है, it's okay. We can change the words. We don't have to write हर जगह administer.
मैम एडमिशन आने की जगह ये लिख सकते हैं ना as required.
As required.
provided.
It is saying time limit.
कौन चेक करता है?
नहीं और प्राइवेट टाइम लिमिट ना पता चल जाए क्या चला रहा है.
No, it's good. Basically, he is concentrating on his studies. So your passive voice was left behind. Any other issue you guys are facing? After that, we can do.
Main grammatical error is yes.
Yes मैम और स्पीकिंग में थोड़ा ग्रामेटिकल है.
He is having lots of error, you know. He is speaking wrong pronunciation also there.
इसकी प्रोनाउंसिएशन में ज़्यादा दिक्कत होती है.
Lots of pronunciation mistake he is making.
When I go too fast, then I do grammatical and
Exactly, you don't have to be fast. You have to see. Have you seen the experienced people? Have you met experienced people?
yeah.
How do they talk?
Slow.
They don't rush.
They talk like
You see the teenager. You see the toddler. Oh, you can't hear. You can't understand them. You have to sit aram se. You have to be slow with them.
explain to what like okay now I didn't.
No.
Okay. A referral was made to the pulmonary rehabilitation program. Medication including an oral antibiotic,
Referral.
was made to the pulmonary rehabilitation program. Medication, pulmonary rehabilitation program. Full stop. Medication, comma, including an oral antibiotic, comma,
Including an
oral antibiotic, comma, was prescribed for 5 days. As needed. Full stop. A fall risk assessment was scheduled to be conducted by the community health team.
a full risk assessment to be
Was scheduled
To be what?
to be conducted by the community health team.
to be conducted
To be conducted by the community health team. Full stop. A follow-up appointment with the respiratory specialist was arranged for 2 weeks.
a follow-up appointment with the respiratory specialist.
Specialist was arranged for 2 weeks. Okay. Is it done?
Yes, ma'am.
Any question? Would you like to write
When
one
we have to
writing?
make sentence like to be done, so how do we make it?
To be done मतलब?
इस टाइप का तो मतलब कि appointment to be done, mobility to be done, exercise to be done.
So see, firstly you collect the information
To be done
and to
कहाँ
be
पे लगा?
done के बाद you can collect all the information with full stop, comma, and then this to be done. Instead of writing to be done, to be done, to be done, because that would be repetition of words.
This to be done with and वो जो भी सारा
Information which to be done.
In profession,
Like whenever we make sentence,
हाँ, it has to be done. If you think it has to be done, अब ये होना है. It completely depends upon the nature of the letter, right?
I was asking structure of this to be done कहाँ पे कैसे use करते हैं?
अभी तुमने कहाँ पे यूज किया बताओ मुझे, कहाँ पे तुमने देख के पूछा हमसे? Tell me.
A whole assessment to be conducted by the committee health team.
Okay, first tell me one thing. How do you manage? How do you outline the important things?
Whom we are writing.
Yeah. Okay. And then, do
Whom
you take all the notes or do you have to, bifurcate? You have to remove, of course.
Yes, filter.
So how do you filter it?
Why are we writing? Whom we are writing?
So in this letter, what will you filter it? Now tell me.
In this letter there are lots of things we can filter.
it's depend on the firstly writing task question.
Exactly. Very good. So in this letter, what will you use and what will you not use? You just tell me this. आप मुझे ये बताइए कि इस लेटर में आपने क्या क्या यूज करना है?
Outline the treatment provided during hospitalization and the ongoing care required to manage. And in this,
history of all accident we will not consider while writing because
Yes,
वो
ma'am.
plan में देना है हमें.
English.
We have to give in plan.
So see, first how will you write? अब यही है discharge का है ये. It's a discharge follow up. Now let me tell you how you will write. I'm writing to inform you. Plus listen to me and then we will have a conversation. I'm writing to inform you of Mrs. Harper's recent hospitalization and discharge plan. Full stop. This is हमारा first para ही चल रहा है. Mrs. Harper was admitted to our hospital on January 3, 2025 with symptoms of shortness of breath, comma, wheezing, and productive cough. Full stop. She was diagnosed with an acute, वही पूरा आपका AECOPD. Okay? Full stop. Now we are going to the next paragraph. Okay? During her hospitalization, comma, see, punctuation plays a very important role. You should know where you have to take a pause, where you have to stop. Specifically him, because he, he speaks. जैसे आप बोलते हो वैसे आप लिखते भी हो. Okay? Mrs. Harper received the following treatment. Intravenous antibiotic हो गया आपका, वो जो मैंने पूरा बोला था. Upon discharge, what the whole paragraph which I told you, because I have already framed that. Upon discharge, Mrs. Harper will require ongoing care to manage her condition and prevent complications. Okay? The following arrangement has been made. Home oxygen therapy, oral antibiotic का जो था वो referral का था, follow up appointment. We kindly request that you conduct a fall risk assessment for Mrs. Harper as part of her ongoing care, because that is something which has happened in nearly 6 months में twice it has happened. Please do not hesitate to contact me if you require any additional info or clarification. Thank you for your ongoing care and support of Mrs. Harper. Sincerely, अपना नाम and everything you will be writing. Understood? So this way you are going to write. Okay? Do you have any doubt? Now see, how will you clear this? Once you write, जितने भी points आपने इकट्ठे किए हैं, you have gathered, you have to show that in another letter. Maybe today you can do a letter and then we can have a discussion on the same.
Same letter I wrote.
Will you guys come
different
tomorrow?
way.
You will come tomorrow?
Monday.
अच्छा on Monday. Okay. Yeah.
If sir will call कि you
हाँ,
will come, then I will.
You can ask.
I wrote this letter in different way.
Same way.
Same letter I
नहीं
wrote.
जैसे मैंने बोला वैसे ही लिखा था.
No, in a different way.
अच्छा.
Because in introduction we have to only put only one diagnosis, the main diagnosis.
हाँ वो AECOPD वही जो मैंने वो डाला वो main है basically. So you should know about the disease also, no?
Yeah, body diagram can hide the symptom and complain. Then if you want to take a look. Same letter.
And you also?
Sorry.
अच्छा. It is with
Yes, ma'am.
See how many words it was? How many words?
It was almost one.
इसमें ऐसा कुछ spelling mistake है?
Yes.
या इसमें ऐसा कुछ नहीं लिखना था ये widow का? You have written a widow?
To do, ma'am, in this word
No.
we can write ED, but
मैंने spelling mistake I have
is
done.
not right.
थोड़ा सा punctuations भी नहीं है.
Normally I follow this.
Yes, ma'am. I will
Little bit you need improvisation. अभी पढ़ के बता रहा आपको कैसा लगा? जल्दी वो सब मैं अपना होमवर्क करके आई थी
तो
इसीलिए.
punctuation कहाँ पे मतलब?
Punctuation मतलब जैसे हर एक चीज में मैंने बताया भी. I have told you punctuation is there, comma is there. Punctuation is your comma, your full stop, your capital, your small. जैसा दिया जैसे P capital है, your P small. So
Actually,
everything should be as it is given, because that is showing someone the other priority.
I write P in the capital, but it looks. I do stop, but comma I don't normally use.
You don't use comma, so you have to use, because that's what your sentence is, one long sentence. It doesn't take a pause. That is the problem with your sentence, no? एक खोलना जरा, ठीक है? So this way they passive and linking. समझ में आया कि नहीं? Addition के लिए लिखो, addition. अगर कोई point add कर रहे हो, you have the words.
Some of I don't know.
Additionally, write it down. Additionally, furthermore, moreover, also, similarly. This is for addition, when you are adding something. Contrast. However, on the other hand, in contrast, nevertheless, despite, despite, cause and effect, किसी cause या effect हो रहा है, as a result, consequently, therefore, therefore, thus, hence, time, meanwhile,
therefore,
thus, 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 and hence. For time, meanwhile, initially, subsequently, eventually, finally. For example, you can say for instance. For instance, for example, specifically, in particular. Emphasize, importantly, crucially. ये emphasize करने के लिए, कोई चीज आप emphasize कर रहे हो, so you can say significantly, importantly छोड़ दो, it's not that word. Significantly, notably, crucially, essentially. Conclusion. In conclusion, to summarize, finally. So this is only for OET I've given. You don't use anywhere. You can use anywhere else, but specifically we use for OET.
Whenever we put comma, उसके बाद तो हमें we have to carry on with a small letter.
Yeah.
After full stop, we have to add capital letter.
Of course. After full stop, there will be a capital letter.
After comma, it will be.
It will be a normal sentence. You're just taking a pause, basically. Full stop is you're stopping. The sentence is getting finished. But comma is saying that you are taking a relaxed, you're taking a pause and then you are continuing. Okay?
I don't understand why Latin key something.
Again, key. Why key?
That.
Yes.
While writing, I don't understand that where should I use comma. That's why I just confused.
See, you cannot just say like this. My name is Amira. I'm going where I do. No, I need to take a pause. I need to take a stop. You should know that which sentence is going to get finished. How you are going to finish it. And if you want to add, then only you use cohesive words, right? Yourself from others. Okay?
After comma, we can use linking word.
It depends. It varies. Okay. Now we'll just stop here. Okay. And so I have taken just a baby step. You should know how you have to change it first, because this is the main problem. You don't understand. Try to, make head and tail of things and try to write a letter and make sure that, you perform well, because this is for you only. End of the day, you need to understand it in